May it be an evening star shines down upon you. May it be when darkness falls. May it be an evening star shines down.
Jesus, 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 Jesus. Sorry,
A simple cough, unchecked, could become life-threatening with time. TB is real, but early detection and treatment can save you.
Chest pains, fever, night sweats, loss of appetite are common symptoms, but TB can mimic any kind of disease. If you are not sure, please go to the nearest health facility and then they will assist you to make a diagnosis.
TB is not a death sentence. It is curable. In Ghana, the fight against TB has picked up over the years. However, challenges still persist. One of such is the preference of prayer camps, lack of information about TB, and beliefs that tuberculosis can only be contracted through witchcraft cause many to turn to prayer camps.
I have a problem with my chest, so I was here for prayers. I'm asking God to help me.
Just like David, there are hundreds of TB patients across the country who abandon orthodox and effective treatment for such prayer camps, and the end result may often get fatal.
They visit prayer camps for spiritual assistance when they fall sick, and only report to the health facility when the cases become fatal.
The disease continues to spread. Many go through a painful ordeal at treatment centers just because they reported a little too late. This trend has been largely driven by factors relating to poverty, poor access to healthcare services, stigmatization, limited awareness, and education.
Let us not discriminate against TB patients. We should rather support the fight in isolating the TB bacteria from the patients.
I have been treated and discharged.
If only we can step up our communication strategy to demystify the illness and let it be known that it's a curable condition and that all you need to do is to present yourself to any government facility and some private hospitals. Then maybe the battle against stigma will be won.
But in the midst of all odds, early detection is an ultimate way forward in fighting tuberculosis. Prevention, education, and awareness are needed. National tuberculosis programs can make significant strides in TB control and facilitate the prevention of drug-resistant tuberculosis.
TB patients are supported by the health insurance scheme. They are treated for other related ailments, whether it is infection, whether it is malaria, whether it is for pregnant women who suffer TB, and any other ailment covered under the benefit package of the scheme.
Available statistics show that in 2012, Ghana recorded a total of 15,000 cases, of which over 856 were children. This high prevalence rate must be addressed. Early detection has proven to be the first most important step towards TB eradication. Treatment success rate stands at about 86%.
3 months ago, I came down with some cough and I didn't know what it was. So I was brought to Kolebu Hospital here. The doctor said it was TB.
Many have taken a bold step, visited TB test and treatment service centers available across the country for diagnosis and followed up for treatment. With funding from the USAID, they are now free of TB and their lives are back on track and are hopeful for a better life.
Ntina minim se ewa boni bia nti emami ba hospital me ba na ese ATB na minim se na boka ti emami dwane ko be na otwe echi no na me hu se ekoso me ba no ye be treat me no na hu se osisi ade eka bia ni ti me di me ho ama se ye treat me.
The U.S. Agency for International Development, USAID, has stayed true to its commitment towards TB control and is working closely with Management Science for Health and National TB Control Program to ensure access to TB prevention and care for all TB patients. The United Nations Millennium Development Goals, MDGs, are 8 international development goals that were officially established in 2000. All 189 United Nations member states, including Ghana, have agreed to achieve these goals by the year 2015.
TB Care 1 is one of the main global mechanisms for implementing USAID's TB strategy. This is by providing global leadership and support to national TB control efforts.
It is also a World Health Organization goal that by 2050, the global annual incidence of active TB will be less than 1 case per million population.
In Ghana, one of the main activities that TB Care is implementing is providing technical support to the Ghana Health Service in improving TB care detection by ensuring that clients and patients access TB test and treatment.
The fight is not yet over, and with the needed support, commitment, and the will to succeed, the world will be free of TB.
TB is curable, seek early treatment.
TB is curable. Seek early treatment.
TB anasan samawa ewaduro pa.
And treatment is free.
TB is curable and treatment is free.
TB control services are available across the country. TB tests and treatment services are free. Seek early treatment. TB is curable.
TB Care will contribute to 3 U.S. Agency for International Development USAID target areas. Sustain or exceed 84% case detection rate and 87% treatment success rate. Successfully treat 2.55 million new TB cases and diagnose and treat 57,200 new cases of multi-drug resistant tuberculosis. Join the fight today to stop TB in your lifetime.
TB is not a ghost disease. Seek early treatment.
TB Care is a U.S. Agency for International Development funded project.